Hello, my name is Kun. Today I'm going to discuss the topic of asthma. In this presentation, I will show one of the clinical manifestations that Mr. Smith has presented with and describe one high priority nursing interventions I will do to improve the clinical manifestation. Firstly, I would like to ask a question. Please, next slide. Do you know that the asthma is the most common chronic respiratory disease with the risk of sudden death? The World Health Organization WHO estimates that there are 300 million people suffer from this disease. With regard to the case study, the clinical manifestation I would like to point out is severe dyspnea. Next slide, please. Thank you. Inability to speak sentence in one breath. Next slide, please. When we inhale, the air passes through our respiratory tract from the nose or the mouth along the large hollow tube called the trachea into our lung. The trachea is divided into two tubes called bronchi in the lung. When the bronchi pass through the lungs, they divide into smaller airway called bronchioles. Every time we inhale, each bronchiole has a small air sacs full of air at the end, just like small balloon. These are called alveoli. Next slide, please. Asthma can cause inflammation or swelling of the lung. It can also cause tightness, called bronchoconstrictions, and particularly tender the airway. Moreover, airway inflammation will cause repeated damage and repair of the bronchioles, creating a vicious cycle and forming irreversible airway stenosis. Repeated infections and acute exacerbations conduct to inflammatory changes such as airway edema, mucus hypersecretions, and trachea spasms. All issues I mentioned above could lead to further narrowing of the airway. As a result, when a patient inhales, the trachea and bronchi are in a delayed state, and the air passes through the airways and finally enter to the alveoli. When people exhale, the trachea and bronchi contract and the originally narrow bronchioles become narrower after the contractions, and some may completely collapse and become occult. The air cannot be fully exhaled, causing difficulty in exhalation. So this is the reason why Mr. Smith having difficulty in breathing. Next slide, please. So regarding to the high priority nursing intervention, first of all, I will let the patient sit down in a semi-recumbent state and let the patient sit on the bed holding the pillow. At this time, I will let the patient waist lean forward so that they can breathe better. Also, I will ask the patient to untie the collar buttons, loosen the belts, and remove the secretion in the mouth if it requires, and also keep the airway unobstructed. After the condition is stable, I will maintain the patient in a sitting position and transfer the patient to do further diagnosis if it required. Always need to be aware that we can't give any pressure on the chest and the abdomen of the patient or do any restrict lung breathing for them. In severe cases, this can cause respiratory failure and life treatments for our patients. In the end, based on the clinical manifestation that is recognized during the examination, Mr. Smith need immediate diagnosis and medical treatment. Again, I would like to thank for you listening to my presentation. Bye bye.